Sexually transmitted diseases here in the U.S. are at an all-time high. That's according to the latest numbers from the Centers for Disease Control and Prevention. Beth Ward here now to break down results of the new data that many are calling alarming, Beth.
When you consider, Chris, that in the 90s, some of these STDs were considered almost eliminated. The CDC just came out with numbers collected from all of 2018, and for the 5th consecutive year, combined cases of gonorrhea, chlamydia, and syphilis shot up. More than 2 million infections reported in just the last year alone. The biggest question is why. The number of STDs, sometimes called STIs for infection, have skyrocketed in the U.S., according to the CDC's latest data. In 2018, there were 2.4 million syphilis, gonorrhea, and chlamydia infections. That's 100,000 more cases than the year before, raising the question why. The CDC lists increase in people getting tested, diagnosed, and reported. Also, drug use, poverty, and the stigma for some of getting tested, as well as decreased condom use among gay and bisexual men and young people.
About half of young people will get an STI, and most of them won't know it because the most common symptom is actually no symptoms at all.
Christine Johnson is the Assistant Director of Health Promotion at Springfield College, which is taking part in a national college health assessment study.
Our last set of data suggested that our students are pretty good at using contraception, and so they are protecting themselves against unplanned pregnancies. But contraception doesn't necessarily lend itself to STI protection.
Johnston says the data also reveals there is work to be done regarding awareness.
We do know that our students are engaged in sexual activity with 0, 1, or 2 people on average throughout the course of a year, and we really just try to put that information out there that they are at a risk of getting a sexually transmitted infection if they're having unprotected sex.
One reason why Springfield College provides free protection to students. Back to the study, the CDC also blames the rise in STDs on cuts to sex health programs at the state and local level. They are now sounding the alarm that STDs can lead to infertility, gonorrhea, and congenital syphilis, which can cause infant death. Now, the new study also shows that newborn syphilis deaths shot up 22% from 2017 to 2018. Doctors emphasizing that many STDs can be cured by antibiotics. In the studio, Beth Ward, Western Mass News.